It's Dr. Shelly, and I have behind me the video and the tips and the checklist that you're going to need to pass this NCLEX or Hesi exam. Now we're talking exit Hesi or NCLEX. The Ngn Nclex checklist that I'm about to go over with you is going to prepare you to get ready and be realistic about what it takes to really pass this life-changing monumental exam. Now, behind me, I'm going to start with this video about the Ngn Nclex checklist. I'm actually going to start doing something a little differently than I've done in other videos about the NCLEX exam. I'm going to make sure, because it dawned on me that sometimes I get students who say, well, I got to study med-surg. I'm like, well, what is that? Do you understand that med-surg is about 20 different topics? And they don't. So I thought what I would do is give you a list of subjects that you need to be fairly comfortable with and feel good about knowing a little bit in preparation for these exams, okay, Hesi or NCLEX. So watch this. Up in the top corners of this board are a list in black of all the subjects you'll need. So I'm going to go over those right now. The psych, geriatrics, and I put those two together because they kind of go together a lot, only because the geriatric population may have, not always, but may have something going on with sundowning, dementia, delirium. They're at higher risk for those conditions. And a lot of times the management of those conditions are put together with psych. And so sometimes those two go together, psych, geriatrics. The next coupling I have here is renal and reproductive. Remember how renal, another word for that is genital urinary? Well, reproductive is in that area. So we know that the NCLEX exam has picked up on its questions that focus on reproductive health. And that's a good thing because Americans are pretty stupid when it comes to understanding their body. You saw that with the whole Roe v. Wade thing, not understanding that a woman doesn't even know she's pregnant before 5 or 6 weeks in most cases. And here you have a heartbeat law that says by 6 weeks, if there's a heartbeat, the doctors can't touch you. So now you're miscarrying in your car and bleeding out because they don't want to do a D&C for a baby that's not going to make it because you bled out so much and your cervix is open and you're losing the baby. But as long as there's a heartbeat, they can't touch you or they'll go to jail. Like, that's fucking crazy. But side note. Anyway, I'm saying that to say that this test is testing you on reproductive because clearly we have a whole country full of legislators that don't get it. So renal and reproductive are together. Respiratory is a huge category, acute and chronic respiratory. Very related is cardio with EKGs. LPNs, you and RNs must know that you need both EKGs on your tests. You need to study these EKGs because what I have found is that in LPN programs, they don't even teach EKGs. And then you go and buy some LPN UWorld or LPN whatever software to try to practice your test questions. They don't even have EKGs. You have EKGs on your test, LPN and RN, both. Okay. Acid, base, fluids, and electrolytes. This is big. You already know that. It's all your electrolytes. It's also your acidosis, your alkalosis, your respiratory, your metabolic, your fluids that you need to know. And with fluids comes the understanding, very good understanding of fluid volume overload and fluid volume deficit. Cancer, immunology, hematology. Prior to the last 10 years, we didn't really focus on immunology. Now all three of these subjects are intertwined. Remember I said cancer, immunology, and hematology. They're very interrelated. If you work at a hospital, you'll often notice that the hematology oncology unit may be linked together. So hem-onc, you'll hear us say, hematology, oncology, hem-onc. Well, immunology is also in there as well, especially when we look at conditions of autoimmune diseases and immunodepressed or suppression, and monoclonal antibodies and different intravenous immunoglobulins. Intravenous immunoglobulins. I know these are big words, but I have to know them to say them as well as I can for you to understand that this is your life as a nurse. You're going to be doing a lot of this work with these patients. So that's all immunology. So if you've ever heard of like lupus and multiple sclerosis and myasthenia gravis and even ulcerative colitis and Crohn's, the treatment of those conditions are done with monoclonal antibodies or intravenous immunoglobulins. Oftentimes those meds end in MAB for monoclonal antibody, MA, monoclonal antibody, A, and B, antibody. So I'm just trying to help you know how to classify everything. Especially when you start doing software, then you'll know, oh, these two are related. Why did they put them together? Because they're related. Okay. All right, so that is this side. Let's go over to this side, okay? Here we have gastrointestinal. You know what that is. And then I put that also up at the top with infectious diseases, which is broad, right? Then you have ortho, and sometimes we call this musculoskeletal. And what goes with that very easily is integumentary, right? Right, okay. Neuro or neurology, ooh, that's a really big topic because you have acute and then you have your chronic, and you know the chronic is multiple sclerosis, myasthenia gravis, Guillain-Barré, amyotrophic lateral sclerosis, or Lou Gehrig's. Those are chronic neurological disorders, and like trigeminal neuralgia or whatever, you know, Bell's palsy. But then the acute neuro is traumatic brain injury and aneurysm, and you know, you just had a stroke, a hemorrhagic stroke or whatever, meningitis. Those are all neuro, spinal cord injury, you know, you get it. Okay, now endocrine is huge, and you already know with that. In fact, I'm gonna just throw it on there because I don't see it on there, but it is part of endocrine, but sometimes people don't think about it. So I added diabetes mellitus or DM to that. So you have your endocrine and your diabetes mellitus, right? Okay. Then we have procedures and perioperative care, right? So peri-op is, you know, pre, intra, and post-op. That involves sterile technique and medical asepsis, and how do you do pain management post-op, and what are the biggest 5 complications following surgery, and the checkoff list or the checklist that you have to know, including the consent form, the pre-op soap scrub, and all this stuff. It's like a discipline of its own, right? Incision, D&E, or dehiscence and evisceration, you know. And then of course there's the big one, right? Like maternity, peds, and let me just add one more thing to the maternity and peds section. You know what I'm gonna add, it's growth and development. So those all go together, okay? So I hope you know that when we look at these subjects, they're massive. Like, you've got a lot to do. You've got a lot to like kind of study. So let's be realistic about how to do it. Come on, let's do our Ngn Nclex checklist. Woohoo! All right, number 1, let's prepare your schedule. You just graduated. You had that big old cake with the stethoscope on it. You had your graduation party. You looked good in your gown and your cap. You threw that cap up in the sky. You better have caught it because that's forever, baby, souvenir. But you did all those things and now you're ready to buckle down. Well, what do? Well, you get a schedule that's realistic. Number 1, the schedule is really going to have to incorporate you not working like a Hebrew slave without sandals, because all of a sudden I'm out of school, I can work 40 some hours a week. Whereas when you were in school, purposely, strategically, you had to take less time at the job and more time to focus on your studies. Nothing has changed. One of the biggest mistakes you can make is, number one, go on vacation right after nursing school before you earned the right to do it. So you think, oh, I graduated, I'm going on vacation. Well, that sounds good, but that's stupid, because you should stay in academia mode. The number one error why people fail the NCLEX is they go on vacation right after nursing school. No, after nursing school, you're not going on a vacation. You're going to get your schedule together. You're going to make sure that the same schedule you had when you were in school, you keep that schedule for studying for NCLEX, and you pretend like you're still in school. So what does that mean? It means not working more than 20 hours to 24 hours a week. So that's 3 8-hour shifts or 2 12-hour shifts. Any more than that, and you're kidding yourself about studying. Now, I will tell you, I was a single parent. I didn't have any help. Couldn't even get $3 out of my daddy for bus fare. So, and my mom was a joke. So I didn't have any help, and I get that. And I didn't just work 40 hours. I worked 50 hours right there at Hillcrest Hospital in my city, like it's really nearby. So because I could not do that, you probably can't either. So if you have to work full time, because that's reality, I get it. I swear to God, I get it. But here's what you're not going to do. You're not going to work 40, 50 hours a week and then think that you're going to spend 6 weeks studying for a test, because then you're going to fail it every time. So if you have to work full time, then you need a longer timeline for how long to study, because you cannot put in the amount of time that another student could who lives with mom and dad, doesn't have any kids, been told they don't have to work, don't have any bills, and they can literally grind every single day and get the hell out of here in 6 to 12 weeks. Easy. No, you can't. Stop thinking you can, because it's ridiculous. So if that's you, or guess what? If you work full time, or again, guess what? If you failed this test before, your timeline is completely different. So this timeline of 12 weeks with 2 subjects, as you heard me talk about, 2 subjects a week, that timeline is for the traditional student who doesn't work full-time 40 hours a week, who doesn't have a couple kids to drop off here, there, and everywhere, and then support their children in showing up for her basketball game or showing up for his football game. Yeah, you don't. This student here, this one, the 12-week schedule, does not have a mom who needs to be cared for and you cook dinner for her every single day. Okay, come on now. So be flexible. Now, when I say that, how can you be flexible? Well, one way that you can be flexible, and this is so important. Number 2, part of our Ngn Nclex checklist is to check the actual ATT expiration on your authorization to test. So what if you don't have an ATT right now today? You have not applied for it. You have not paid for it. You have not done anything to get the authorization to test, ATT, that comes from the what? Board of Nursing. Who? The NCSBN, or National Council State Board of Nursing. In my state, it's the Ohio Board of Nursing that I have to apply to get my ATT. What if you don't have one yet? Good. Don't apply for it until you're ready. And if you don't have one yet, make sure you find out what time frame your state gives you. Look at this. Some states only give you 30 days to get your shit together. That's rare. That's really rare. But hey, that's a short amount of time. Thank God we don't see that very often. Some states give you 60. Some give you 90. Some give you 6 months. And of course, here in beautiful Ohio, we're smart. We give you a whole year. What that means is that, like Florida, as I recall, used to give you 6 months. Now they only give you 3 months, which is wrong. They took the time that it takes you to study and took it and shortened it from 6 long months, which I think is really reasonable, to 3 short months, which is not. So the minute you receive your authorization to test in your email, they're going to give you a deadline. I need you to look up that deadline if you already have your ATT. If you don't have an ATT, stop the presses. Don't go get one. No, not until you find out what I have to say in this video about the scores. And while I'm at it, this video is the shit. I need you to hit that subscribe button and quit playing with me. Okay, so again, check the actual ATT expiration date. Write it somewhere, put it in your phone. I don't care what you do, but you got to know that date. Too many times you guys pay for a consultation with me. And when I do the consultation, I ask you, when is your expiration date? And guess what you've done with me? Guess what I've seen happen when we do this whole consultation? You have told me, number one, what's that? Number two, you've said things like, oh, I can't find it. Like, I'm on the phone waiting on you to find it and you can't find it. And then I'll explore a little bit more and it'll come to fruition, or it'll be obvious that you never applied for it because you didn't know that you have to reapply for one every time you fail. Yeah, I see that even in my class. Or I'll ask you, what is that expiration date? And you'll tell me, oh, it's, I think it's the last week in October. And then I'll go, I don't want to hear what you think. I need you to go look it up, and I will wait until you do. And you're on the phone with me looking it up, only to find out that it expired. And you didn't even know it, because it didn't expire October 1st. It expired September 1st. Now you're fucked and got to reapply for it. You see where I'm going with this? So I love you enough to tell you, stop it. Go find out the real expiration date, people, please. And write it somewhere. Write it on the top of your binder that you're studying from, your Oh My God packet that you got from me. Whatever you can do, do it. Okay? Because this is a big problem. The student doesn't know when the test expires, the authorization to test expires. Don't tell me your test date, tell me your expiration date. That's what I want to know. But look at this. Whatever the actual expiration date is, make your test for the last week in that expiration date. For example, let's say that your test authorization expires September 30th. Well, then your test should be that week, but not that day. It should be sometime in that week. In other words, give yourself the maximum amount of study time if you're in a state that expires in 3 months. Are you listening to me? If you live in, like, Florida, 3 months expiration, set your test date for the last date, the last week of that test date. Now, if you're in a state that expires in 6 months, you can do the same thing, but you might not need that much time, but you might. If you're in my state that expires in a year, don't schedule your test at all. Just wait until your scores dictate when to schedule. Here's another tip. If you failed this test, the worst thing you can do, because I know you get that letter from the board, the worst thing you can do is turn around 45 days later and reschedule it. 99.99.99% and maybe even 100% of those people actually fail that second or third or whatever test it is for you. You are not ready 45 days later. You need to wake up and say, if I failed, I need to do something new and different completely. And if you're doing your test 45 days from now, you probably didn't do a whole lot new or different. Okay? All right. The other thing I want to say about that authorization to test expiration date, Remember, I have a lot of students who don't know you can change your test date 7,000 times without fear of any fees. It's free. You just go online, call them up, whatever you want to do, use your phone to change your test date. You can change your test date an unlimited amount of times. Don't get caught up thinking, oh, I have this test date, now I got to stick to it. Not so much. Okay, next on the list is know your risk for failure and your school's NCLEX passage rate. I talk to students every day that have no idea whether they went to a good school or not. I say, well, was your school a good school? Because obviously I'm in Ohio and I don't know all the schools, although I do know one thing. If you're in Florida, 99% of those schools suck ass and are horrific if they are standalone nursing schools. If they're if they're part of a university setting where the school teaches a lot more than just nursing, you may have gone to a good one. But when it's just a regular standalone nursing school, it is a very horrible place to go to nursing school. And a lot of you think, oh, I'll just go to the online program out of Florida. I need you to think again, because from what I'm seeing, the FBI has an open investigation and they're looking at all of these schools, different schools for sure, and they're seeing how you bought your NCLEX here and you got a school that said they will only take cash for your tuition, so you can't even track that they were a piece of crap. You're going to nursing school today and all of a sudden a month later, this storefront nursing school disappears. Yeah, be very careful about doing anything in Florida. And you already know the state in general is very racist. We know that. Okay, the NAACP told you stop going to school there. Tyreek Hill was arrested and manhandled and just treated like shit by the police department. So, like no respect, just thrown to the damn ground. This is a football player. I think you know by now. It's been all over the internet. But anyway, just stay away from Florida, except to get on a boat to go to to go to Disney World boat. What is it? Disneyland cruise, or to go to Disney World, or to go to Florida to get to Disney World and then take your ass back home, because they are not where you need to be. Okay, just saying. Side note. Okay. All right. So you need to know you can change your test date anytime. You also need to know your NCLEX passage rate for your school. Your NCLEX passage rate for your school needs to be higher than 80%. Somewhere around 75 to 80% is a good passage rate, because in the country, 79% to 80% is about average passage rate on this NCLEX. Now, so that's important. Now, when I say know your risk for failure, I need you to know that if you are born outside of the United States, you have a very high chance of failing this test. The passage rate for regular American-born students is about 79, 80%. For the student born outside of the United States, it's about 47%. Also, the more you take it, the more you fail. So I say that to say to you that if you failed it more than a couple times, pump your brakes, think about, oh God, let me stop. What do I need to do super different? You might need a class, I don't know, but that's the deal. The English second language students born outside of the United States. The LPN to RN, or the bridge student, has a very high chance of failing. Why? That sounds so counterintuitive, doesn't it? Like counterintuitive, because you would think if you're LPN already, you know nursing, so why wouldn't you have an easier time of it? No, you have a harder time, because normally when an LPN has finished taking their test and gotten their license and then they go to work, they work in places where there are shortcuts and very, very bad habits with regards to nursing actions with their patients. For example, if you work in a nursing home or a long-term care facility as an LPN, it's nothing like working at a hospital where the test is usually based a lot on hospitals. It's not based on long-term nursing facilities. You cut corners, you pick up bad habits, you do crazy things in a nursing home. You risk your license a lot of times. I personally would never put my family in one because I've seen horror stories. So my point to you is, If you are an LPN already and you're going to take an RN test because you're in an RN program, understand that you actually do have a higher risk of failure because you have picked up these bad habits and you go in this test thinking that's what I do at my job. Wrong answer. Also, you tend to have a high failure rate because LPNs, especially the ones I know, when it's time to take the NCLEX exam, you're working full-time as a nurse. And because you're already working full-time as a nurse, that is your title, it's hard for you to take off of work because nurses are needed so much. It's hard for you to cut back your hours because your boss doesn't want to hear that crap. You tend to work a lot as a nurse, even overtime half the time. You may have lived outside of your means, which means that everything is on credit. So now you're paying this $600, $700, $800 car note because you wanted to be riding large, and now you've got to pay for that car. Or you charged up God knows what on credit cards, like those $400 bundle of hair. I know y'all. Your hair look good, boo, but now you can't take off of work to study for your NCLEX. So think about some of those things because I see it all. This is what I do for a living, okay? So the ESL, the LPN, the RN, and then also lastly goes back to what I said about finding out what your school's NCLEX passage rate is. On this Ngn Nclex checklist, you need to make sure if you found out you went to a bad school, if you went to, again, a bad nursing school with a very bad NCLEX passage rate that's less than 75%, then you're going to need to kind of teach yourself all over again. Sometimes that requires that you start over and just go and learn everything because they didn't teach you anything. I had a young lady in here at the boot camps that I do, the 3-day boot camps up in Cleveland for anybody all over the world or country. We just had somebody fly in 19 hours from Saudi Arabia. I just had a young lady in my class. She wasn't the one from Saudi Arabia. She was, I think, from Florida. Oh, here we go, Florida. She said that the nursing school and the nursing instructors purposely let you cheat so you can get out of there and they look like they have a high graduation rate. Ooh, baby, ooh, baby, ooh. Ain't that sweet? Now, she was in my boot camp class. So she said that that's going on at her school. I wanted to vomit. And she felt strongly, good for her, that A, she doesn't know anything because B, they never taught her, and C, they let her cheat her way through and everybody else in the school by looking at their books while they're testing and everything else. So she signed up for the course and she was shocked. She's like, I know nothing. Like, all of this is new to me. I said, that's okay. We have a regular course as well to help you out. We have the packets. Do what I taught you in these 3-day boot camps, which we have another one coming up in October and November, and then take it back to Florida and implement what I taught you because you got this, okay? All right, so that's it. Now, number 4 of my Ngn Nclex checklist is there are no two ways about it. You must buy UWorld. Stop with the Archer, would ya? It doesn't work. It doesn't work unless you've got a really good understanding of the human body, anatomy and physiology, and you were really good in school and you just need a little bit of help me out and you want to buy this Archer. I don't have anything to do with UWorld. They don't pay me to say this. I wouldn't let them pay me if they asked. I don't give a shit. I don't need their money. So what I'm telling you is from my PhD heart, which means I studied my ass off on how to get you to pass this NCLEX exam. I have a PhD in it. Dr. Shelley is telling you to buy the UWorld. It works every time if you work it. So what am I saying? What do you need? Well, most students need 90 days. Very few need 60. But I did put by 60 to 90 days of UWorld. If you're an LPN, listen to me, LPNs. If you're an LPN, you still need to buy the UWorld RN because your UWorld LPN does not have EKGs. And EKGs are all over your test. Hello? Yeah, so there you go. Now, this UWorld, You must do every question on UWorld before you take this exam. So you should be doing about 300 to 500 questions a week. And the only way you're gonna do that is to do it all day, every day. So you woke up and you did 5 questions. You went on your lunch break at work and you did 5 questions. You were over at when you came home from work, you did 5 questions before you laid your head down. When you had the day off, oh, you tore the club up. Your questions, even though I tell you no more than like 25 at a time, you had time, so you did your 5 to 25 at a time, but you did 20 of those in one day. So 300 to 500 questions a week. On your days off, you've got to do nothing but content videos and questions on UWorld. You're gonna get good at it, but you don't get good at stuff you don't practice, and you have to practice these questions. Now, one big mistake a lot of students make is they think that if they buy the UWorld and only do the UWorld and never really look at content videos, they're gonna pass. We know a lot of those students. They're right in my classes. They failed. It's more than questions. It's also understanding content. And you know what I told you? I put all 500 of my videos in every single one of these subjects in black that I started the video off with. I've got a video in each one of those subjects, and it's all for free. Like, I put over 500 videos out there for you for free. My whole nursing school is out there on YouTube under HETV for free. So listen, you don't even got to pay no money. Just go look at the videos, do the questions. Now, this UWorld, you will also find under my HETV videos that I have at least 2 videos to show you how to set up your UWorld account, what to do, when to do, how to do it, so you maximize your potential of really getting everything out of this software. And look at this. As soon as you get your UWorld, you need to immediately do the assessment for your baseline to know where you are. So let's say you just purchased your UWorld today, but you got to go to work, right? You just, you hurried up and bought it. You heard my yapping in the background and you're like, oh God, Shelly says buy UWorld. So you bought the UWorld, but you got to work today. This is not the day to do a pre-assessment test, right? And it'll say assessment RN. This is not the day to do that. You must pick a day when you're actually off. You can simulate doing a test. You can sit there in your kitchen, your living room, or wherever you are, Panera's or wherever you go study, and you can do this assessment exam in the UWorld software. You can do it without breaking it up in a couple days. So remember, the real test, you get a break at 2 hours. So you're sitting down, you're doing this UWorld exam. These are questions you've never seen before because you just bought the software. And when you do it, you take a break at 2 hours, just like a real test, and then you complete the exam. This is the only exam on UWorld you will not be reviewing the rationales. When you complete this exam on UWorld, you're gonna know what score you're starting off with. Now, don't be surprised if your score is 30% or 40 or even 50. Just know that that's gonna help you know. Don't take your test anytime soon. If your test was scheduled in the next, 8 weeks, you're never gonna make it. Not if you have 20, 30, 40% as an average right now on this test. No, because I already told you, you need 75, 85% average on these test questions. So just know you need to know where you're starting at. And that's it. Then you go ahead and you get started with the software based on the videos that I give you that tell you how to do it. Now, number 5 of the Ngn Nclex checklist is look up and know. Look it up. In other words, Google it or YouTube it. I have lots of videos if you need it on this issue, but look it up and know the 2023 Ngn Nclex test plan. Because remember, you guys, The test dramatically changed in April of 2023, right? We all know everything changed in April of 2023. Now we've had a full year, April 2024, to evaluate and see what's going on. We kind of know what to expect, but you must know the test plan. I give you lots of videos. One of them is the CPR report. I have a video about that. That's the test plan. So when you look at this test plan, you will see things like management of care if you're an RN, or coordinated care if you're an LPN. You will see safety and infectious disease. You'll see health promotion and maintenance. You'll see basic care and comfort. You'll see pharmacology. You'll see reduction of risk, physiologic adaptation, clinical judgment, the test plan. You gotta know the test plan and what does it mean. I have the videos for you to watch that, but you need to do that as soon as possible because you've got to kind of understand, especially if you failed, how to focus on those areas, okay? So you just go to the HETV playlist, you know, pull up CPR report or test plan, you'll be fine. All right, now, we're almost done with our checklist. Are you staying with me? Okay. On my Ngn Nclex checklist is make your flashcards. I'm sorry guys, but the best way to learn your medications, and they're all generic, but the best way to learn medications and infectious disease precautions is to make the flashcards. You can't really get around it. And just so you know, I will show you, and maybe you can take a picture. I don't have a problem with you taking a picture of this. I'm going to show you my flashcards, one for a medication and the other one for an infectious disease. Remember, when you make your medication flashcards, you always make them off of the category. So this category flashcard that I made was beta blockers. Again, you are just not making individual meds. No, you're making categories. If you learn your categories, you'll be fine. So you'll see on the card itself, it says beta blockers. And of course, you see the OLOL, which is the ending. And then you even see me make on the flashcard a real common beta blocker, which is metoprolol. But then when you flip the flashcard, you can see here on the lines, I put what it treats. So we have, you know, of course, it says treats hypertension, angina, AFib, and what's the other word? Anxiety, test anxiety. You'll see it says check blood pressure and pulse. You'll see no asthma or COPD or lung disease. You'll see no diabetics because it masks it masks your hypoglycemia. It blocks the stress response. Then I have the meds at the bottom. So, you know, you can see that. If you look at my infectious disease flashcard, you will see the infectious disease on the front, and then you will see the precautions on the back. So contact precautions, what does that mean? What kind of PPE is required is the gown, glove, and then it says DE, which is dedicated equipment. You will also see it's caused by strep A, and then you see that it's honey-colored crusted pustules and the complications rheumatic heart disease, glomerulonephritis. And so there's no vaccine. And then the treatment you can see is bacitracin or neomycin ointment. Again, you might be thinking, how the hell would I know any of this? Well, you know your girl. She always has your back. And I have something called pink packets that everyone kind of knows about. So for the actual infectious diseases, they're in here. And you use the list that I give you right in this infectious disease packet, and you use that list to make your flashcards. And then your medication categories, oh, everything is in here. And this is your 2024 medication categories packet. They're just part of the pink packet, so don't worry if you need any of that stuff or you don't have a good medication category reference. Then you just text me at 216-410-0936 and I will get you whatever you need, right? So just don't worry about it. But moving on. You make your flashcards, medications, infectious diseases. 2024 medication packet is a pink packet I just showed you. Infectious disease list is the pink packet as well, okay? Then you see here, number 7 of my Ngn Nclex checklist is that you need to buy 3 5-subject notebooks. And these are the big college ruled big 5-subject checklists, 5-subject notebooks. And for each of those subjects, you put another topic. So for example, if you took one of your 5-subject notebooks and you put psych and geriatrics on one, renal and reproductive on another subject, respiratory on another one, cardio EKGs on another one, you still got all these other subjects, which is why you usually need 3. Now, if you don't want to buy the 3 5-subject notebooks to take notes off the videos and the questions that you're doing, because remember, every time you're doing the questions, you're reviewing the rationales, and every time you're doing questions in a subject, you're pulling up a video in that subject. And if you don't want to do the 3 5-subject notebooks and you kind of need more structure, like you need a handout in each and every one of these topics, like every single one of these, you would love it if you had a study guide packet. That's called the Comprehensive Self-Study Packets. And our link on HETV in YouTube, that link says PayHip. It's right up under the title. It says PayHip for shopping or whatever. You can get that as well, but you don't need it, but you could get it if you wanted it, okay? Now, number 8. Number 8 is study content on YouTube. Obviously, I think I have some really good videos, but many of my colleagues in the field have really good videos as well. I like, I think it's called Level Up RN. I love those videos. What is it? Mark Klimek has good videos. There are good videos everywhere. Simple Nursing, I think it is. Another channel that's wonderful. You can find really good videos. So what you have to do, obviously I think mine are great as well. HETV has over 500, but what I'm saying to you is no matter whose videos you pull up, you need to pull them up because you've got to hear it. It's not enough to read it. It's not enough to see it. You've got to hear it, and you got to hear it often enough to get it in your spirit and your system and be able to pull it out on a test. One of the things I encourage you to do is, you should by now, but every now and then I get somebody who doesn't, you should have the YouTube app on your phone. You should have that phone Bluetooth to your car so that anything playing on your phone comes through your car. And many of us drive really far to work, and instead of listening to Cardi B, you better be listening to Shelly B, because this time that you have is very limited. And if you can't use every waking moment to learn, then you forgot what this is all about. This is a grind, right? This is your grind for the next 12 to 16 weeks. This is your grind. Okay. Now, the HETV videos, it's very important that you know how organized they are. They're organized under the playlist. So for example, if you pull up the psych playlist, the first set of videos are going to be personality disorders. The next video is going to have to do with depression. The next video after that is SSRIs, or medications that treat depression. The next video after that is obsessive compulsive disorder, OCD, PTSD, and on and on and on. So you have a whole playlist to cover everything that you ever need to know about psych. The same is true for any of the other playlist. Okay, it's all these videos, and you know how YouTube is. It lets you just hit play all, and now you've got an entire lecture series on that topic. So come on now, I got you. Now, number 9 of the Ngn Nclex checklist is don't overdo studying for case studies. What do I mean by that? Well, here's the facts, guys. You guys do really, really well with case studies. you don't do so well with other subjects like basic care and comfort, which we have a video for, or your procedures that you need to know. Basic care and comfort is the #1 area of failure on this NCLEX exam. I get sick of saying it, and it's tied with procedures. So let me show you what I mean. If you look at this, procedures, basic care, procedures, reduction of risk. The category on the actual test plan is called reduction of risk. Well, that's procedures and basic care and comfort. So basic care and comfort and procedures are in there. But you guys fail this section of NCLEX the most. You fail reduction of risk and basic care and comfort the most. And you really need to know that studying a case study, doing case studies, is not going to help you on this stuff. No, it's not. It's a waste of your time. Because here's what I've seen with my nursing review program. You guys do really well on the case studies. You kind of like the case studies. Like you get off on the case studies. Like you happy about your case studies. Well, it's not about the case studies. That's just a small portion of your test. You've got a whole bigger test to do. You've got a lot more on the test to know. And case studies, you keep getting aboves in, and then you keep getting belows in all the rest of the stuff. So please, no math. Do not study math, because the chances are you're going to get no math on your NCLEX. And don't put a lot of time in the case studies. I have sample case studies on HETV, and other than looking at Grey's Anatomy and doing the case study that I attached to it, you know, Grey's Anatomy on Netflix, I did case studies on those. Other than just looking that over, and I teach you how to even do it, please don't go crazy studying case studies. That's a waste of time. Number 10. The way we do what we do in Shelly's Nursing Review and guarantee you that you're going to pass in my class, you know, all my students get my money back guarantee. The way we do that is we study one subject at a time. We call it mastery. We master one subject at a time. So what you're doing is you are mastering one subject at a time. So let's look at psych. You are doing psych questions every day, all the time, a bunch of them, bunch of small little tests. Never, ever do a test more than 25 questions unless you're trying to get a final exam in it. So you're just doing tests all day, every day, all day long. You're doing 5 questions here, 10 there, 25. In one day, another 5-question test. Oh, before I go to bed, I'm gonna do 5 more. Oh, I got a lunch break, I'm doing 10. Yep, I woke up, I'm doing 5. You're doing them all day long. But, as soon as you get that 80% or 85% that you need, you are doing the final exam. So let's say that you did 6 tests yesterday, 5 questions each, 6 of them, and then you did 4 with 25 questions in them each the next day. And then the very next day after that, you did 1 more test and you're like, oh my God, I finally got an 80%. I finally mastered psych. Stop right there. Now you need to do a final exam. So do 85 psych questions. And if you maintain that 75 or 80%, move on to, you guessed it, renal. You see how I did that? I hope you are very clear on how I did that. You are beating the shit out of the subject so that no matter what question they ask you on this NCLEX or Hesi exam, you can pass it. Because you know it. You know it so well, okay? So one subject at a time. Now, if you have failed before, you must pull up your CPR report and you must look at what did you get belows in. If you have belows in any topic, remember I have videos on those test plan topics from your CPR report. So you got to go to that management of care playlist if you got a below in management of care. If you got a below in basic care and comfort, you're going to have to go to that basic care and comfort video. If you got a below in pharmacology, you're going to have to go to my pharmacology playlist. If you got a below in health promotion and maintenance, that's really hard because that's a lot of subjects. That's growth and development, pediatrics, and maternity. Yeah, I know it's hard, but you got this. Now, last but not least, right? If any of this needs to be repeated in your spirit because you're only human and you forgot every damn thing I said, you can go to my HETV YouTube channel, pull up the Ngn Nclex self-study tips and guidance playlist, not video, playlist, and know that in that playlist is everything I just said and more. So deuces, I hope this helps. Again, feel free to call me if you need any resources. We got everything. Also, everything I said today is in the Oh My God packet. That's for those of you who don't read that Oh My God packet. You already know what I'm going to say. Get you one, hun. Bye-bye.